This is me and Michelle Hervey's ophthalmology project. We are doing Entropion. The veterinary importance of Entropion is that the eyelids are used as protection for the globe, but pets experience a condition called entropion will have complications of the globe. Entropion is a condition where the eyelids roll inward towards the globe. The eyelids cannot protect the globe properly, causing disease. Entropion is commonly seen in dogs, but is less common in cats. The cause of entropion. There are two forms of entropion called primary, congenital, or secondary, acquired. Entropion is influenced by multiple conditions such as the length of the eyelid and the conformation of the skull, orbital anatomy, ginger, and the extensive of folds of the facial skin around the eye. Animals with the primary form of the entropion are breeds with the predisposition due to large orbits with deep eyes and lack of lid support. Predisposition primarily entropion are collies, Great Danes, Irish setters, Doberman pinschers, golden retrievers, Rottweilers, and Weimaraners. Brachiocephalic breeds are also predisposed to primary entropion. The secondary entropion is caused by poor muscle development involving the ocular muscles. It can also be acquired as a result of trauma, inflammation of the infection, and form of skin laxity associated with aging. Now, there are selective breeds that get entropion. It could be Chows, Shar-Peis, Rottweilers, hunting breeds, German Pointers, Labrador Retrievers, Golden Retrievers, Great Danes, St. Bernards, Bloodhounds, Chow Chows, and they all get different kinds of entropion. Some occur in the upper lip, some occur in the medial lower lid, some occur lateral 3/4 lower lid. It's very detailed. And then the clinical signs of entropion. Roller inward of lid margins. Ephora, overproduction of tears coming down the eyes. Thick ocular discharge right here, very, very thick. Chemosis, conjunctiva or therma conjunctivitis. So there's a lot of red inflammation in the eyes. Blecker spasm, eye twitching. Pain, causing depression, lethargic, and aggression. Corneal ulcer erosions or ruptures. Photophobia, rubbing of the eyes and self-trauma, and edema of the eyelids. Entropion is diagnosed by clinical signs of the eyelids rolling inward onto the globe. Complete ophthalmologic exam, all structures of the eye, including the cornea, the conjunctiva, and lid margins. The evaluation of the lids will be done without sedation to prevent overcorrection, undercorrection of defect. Now, treatment is very painful. If left untreated, entropion can lead to cornea scarring, erosion, ulceration, and rupture, and eventually blindness. The effective treatment for entropion is surgery. In mild cases, though, topical antibiotic ointments and artificial tears or lubricating eye drops may be the appropriate case. Surgical options, and surgery is the most effective way, but the animals have to be more mature, so a lot of facial features don't change over time as much, but mostly the surgical option is the route to go. After maturity, once the dog has matured, permanent surgical repairs of the entropion can be considered to restore normal eyelid conformation. It is called the tacking procedure, and that involves rolling of the eyes to affect eyelids away from the eye that is holding them in place with sutures. So it's like taking the eyelash and you're pulling it down and suturing that up. This procedure may be repeated while the animal is growing over time because facial features do change. Depends. Some doctors don't do it once they mature, and some doctors do. Depends on the veterinarian's recommendations and their opinions. There are several different surgical techniques to be accomplished this correction, but they all involve averting the eyelid margin away from the globe of the eye. Away, never inward, away. By removing the portion of the eyelid and pulling it together and suturing. And the prognosis is for dogs that can have surgically corrected on the positive note, as long as the treatment takes place before the eyes are permanently damaged. Periodic treatment with antibiotic and lubricant drops, creams, or ointments may be appropriate if infection or inflammation occur. And that is Entropion.